I'm joined now by Dr. Eugene Kolker, Chief Data Officer at Seattle Children's. Doctor, thank you so much.
Thank you for talking to me.
What's the current state of predictive analytics in healthcare? Are they actively being used?
It's hard to tell industry-wide, but me being first Chief Data Officer, to my knowledge, in healthcare, we're doing it for 6 years, and there are many places I know of who are doing it as well. Boston, LA, San Francisco, many places, Kaiser Permanente, a lot of the Mayo, a lot of places who are doing that.
So it's happening.
Yes,
it's
happening. It's happening.
How is data use in healthcare different from other domains? I mean, are the stakes simply higher?
Yes and no. Basically, it stakes much higher because we're talking about health of people,
Sure.
right? We want to improve care. At the same time, I would say 80% of problems are more or less the same. We have a lot of similarities, but our difference is also important. In our case, if you talk about big data, 5 V's of big data, in our case it's more veracity and variety and value, of course. But other places, not in healthcare, they're primarily about volume, velocity, and value.
Okay.
That's the major difference.
Yeah. So if we narrow this down a little bit, how will predictive analytics benefit individual patients?
In many different ways. Primarily, we're trying to improve care. I can give you one example from our own experience. I was talking about that yesterday. We use US News and World Report metrics to improve care and reduce waste. One of the key recommendations we just gave to our institution is to do immunization reporting on daily basis. Up until now, it was happening on monthly basis. It's bi-directional between us and state. And right now, we're intermediate state because of our recommendations. We already do it on weekly basis, and we are implementing, as we speak, daily base immunization reporting, which is extremely important, especially when you have kids who is being discharged, right? Patients being discharged, depending on their immunization reporting and history. This drug could work, and this would not. So you better know real time.
So this, it does trickle down. We're not talking about something that exists at the top level.
It's very real.
Last question for you, and I couldn't resist asking this given that I don't think I've met a chief data officer from a hospital before, but what are the primary responsibilities in your day-to-day?
So my job description was actually modeled by job description of chief data officer at Yahoo.
Yeah.
And the Capital One, I'm not kidding, okay? And I still work under the same job description.
No kidding.
So we're trying maybe to think over strategically about next year's, but it's more or less the same. 80% are the same issues. One sentence, it would be utilize data as strategic asset of the institution of enterprise.
So that carries over, yeah.
It works anywhere.
Very interesting. Well, thank you so much for taking the time to chat with us.
Mike.
Appreciate it.
Thank you.